Imagine an older adult with chronic kidney disease taking 8, 10, or even 12 medications daily, each prescribed with good intention, yet together potentially causing more harm than benefit. What if the very treatments meant to manage chronic illnesses are actually accelerating kidney decline and increasing the risk of adverse drug events? I'm Tatum Williams,
And I'm Maura Van Bogart.
and we're presenting on polypharmacy in older adults with chronic kidney disease.
Our PICO question is, in older adults with chronic kidney disease, how does polypharmacy compared to non-polypharmacy affect kidney function and adverse drug events over 1 year? This topic is important because patients with chronic kidney disease, or CKD, often have multiple comorbidities that require multiple medications, leading to polypharmacy. In CKD, reduced kidney function also affects how medications are cleared, further increasing the risk of drug accumulation and adverse drug events.
Getting into the background of the study, CKD is common in older adults and often accompanied by multiple comorbid conditions such as hypertension, diabetes, and cardiovascular disease. Because of this, patients require complex medication regimens, leading to a high prevalence of polypharmacy.
Polypharmacy is commonly defined as the use of 5 or more medications at one time. Polypharmacy affects approximately 60 to 90% of all patients with CKD. This statistic is concerning because evidence has shown polypharmacy to be associated with increased adverse drug reactions, medication noncompliance, hospitalizations, mortality, and faster decline in kidney function.
Additionally, age-related physiological changes combined with the decreased renal clearance in CKD greatly impairs the body's ability to metabolize and eliminate medications. This further increases the risk of drug toxicity and harm. Because of this, managing polypharmacy is essential when caring for older patients with CKD.
To evaluate the effects of polypharmacy in older adults with CKD, we conducted a lit review using PubMed and CINAHL. We included studies from the past 5 to 10 years, focusing on adults 65 and older with CKD. A total of 6 studies were included, including systematic reviews, a meta-analysis, and cohort studies, with levels of evidence ranging from 1 to 4.
Getting into the results, across the 6 studies included polypharmacy was consistently associated with worse outcomes in older adults with CKD. The most consistent finding across studies was an increase in adverse drug reactions along with higher rates of hospitalization and mortality.
Several studies also showed a faster decline in kidney function, measured by decreasing estimated glomerular filtration rate. Another important finding was the impact on frailty. Milk et al. Study showed that polypharmacy nearly doubled the risk, especially in patients with CKD.
A meta-analysis reported that approximately 69% of CKD patients experience polypharmacy, illustrating just how common of an issue this is. Doplet et al. Showed that a pharmacist-led medication review reduced adverse drug events, indicating that polypharmacy is in fact a modifiable risk factor. Overall, the findings were consistent across level 1 through 4 evidence, strengthening the reliability of the results.
Overall, the evidence shows that polypharmacy is a significant and modifiable risk factor in older adults with CKD and is associated with increased adverse drug reactions, mortality, hospitalization, frailty, and decline in kidney function. Based on this evidence, several nursing recommendations can be made. Nurses should perform medication reconciliation at every care transition, such as admission, discharge, and outpatient visits. Nurses should also conduct routine medication reviews every 3 to 6 months in older adults with CKD.
In addition, nurses should monitor for adverse drug reactions, provide patient education, and collaborate with providers and pharmacists for deprescribing. These interventions can reduce adverse drug events and hospitalizations, improve med safety and adherence, and slow the progression of kidney disease.
Barriers to this include time constraints, limited resources, and patient resistance to med changes. Ethical considerations include maintaining patient autonomy, ensuring informed decision making, and balancing deprescribing with the need to continue essential therapies.
In conclusion, polypharmacy is very common in older adults with CKD and is strongly associated with worse outcomes, including increased adverse drug reactions, mortality, and decline in kidney function. The evidence consistently demonstrates that polypharmacy is a modifiable risk factor, making it an important target for nursing interventions.
Nurses play a critical role in medication reconciliation, routine med reviews, patient education, and collaborating with providers and pharmacists to support deprescribing. Implementing these strategies can improve patient safety and outcomes and enhance overall quality of care in this population.
Here is our poster just one more time. In the bottom, we have a QR code for our references. And yeah, that's all.